Right now, the health insurance industry is seeing some changes, and this morning, Faulkner takes a look at how those changes could affect your family.
I'm Faulkner with the CPA and business advisory firm of Cooney, Faulkner & Stevens. We're here today with Terry HORAN. Terry's the president and CEO of HORAN. And Terry, it's been 2 years since health care reform legislation passed, but last month the Supreme Court came out with a very important decision that really impacts everyone in this country. Maybe you can share what that was all about.
Well, I think, Crystal, the easiest way to say this is that the Supreme Court upheld the mandate that everyone in the country needs to have some form of health insurance as long as they're making at least, or pay a penalty, unless they're making more than about $15,000 a year.
And you said penalty, but interestingly enough, the Supreme Court actually rewrote and rephrased that term. It's now called a tax.
Yes, correct. And I apologize, but it is a tax, and that's how the Supreme Court phrased it. And so the Congress has the power to tax, and so therefore we're going to call it a tax.
So what's that really mean for people watching this morning? What's that mean to them individually?
Well, if they're over this $15,000 combined family income and their employer is not providing health insurance, they've got to go out and purchase the health insurance. Now, the government is also going to make it somewhat simple for them to get through the roadblocks that have been in the past put up if you are in poor health. But you will be able to purchase insurance somewhat easily through one of the exchanges if it's not available through your employer.
And I do think that whole concept of exchange is somewhat of a confusing concept because in Ohio we don't have an exchange.
It appears at the moment the state of Ohio has suggested that they will not set up an exchange. That could change too. But if they don't, the federal government will bring in an exchange, and we're beginning to hear about now the idea that companies will form private exchanges. And a couple of those are in development right this second.
And this new rule about the individual insurance mandate goes into effect
January 1 of
2014, correct?
14,
yes, 2014. Now, the other thing that's going to happen next year quickly that people will see that will happen in 2013 is they're going to notice that the insurance premiums their company are paying are on their W-2s.
Yes. So, first of all, as you say, it's going to be on their W-2s, not necessarily taxable, but on the W-2s. And secondly, the employer must distribute a 4-page summary of what their plan is if the employer is providing the insurance.
A lot of information. The key here is just pay attention, make sure that you know what's coming down that's going to affect you and your family as it relates to your insurance.
Absolutely, no question.
Terry, thank you so much for being my guest.